Hi, my name is Jessica Hewitt, and this is my video presentation on remote collaboration. After reviewing the Villa Health Assessment, there are a few things that could improve the safety and the overall outcome of the patient within this scenario. One improvement could be handouts and continuing education with the parents. In this scenario, the healthcare professional were willing to review the symptoms and walk the parents through information. However, if the pediatrician or the other healthcare professionals were not readily available, information should be readily available via pamphlets or educational videos. Another improvement could be better management of the possible malnutrition that was mentioned or other complications of this disease. The providers discussed malnutrition being possible because of their assessment findings. However, they never addressed this issue fully. The pediatrician was not sure how to access the pancreatic enzymes needed for this patient's nutritional status, and the parents would need education on signs and symptoms and when to see a doctor. There are a few things that could have been done for the patient, such as management of the other side effects of cystic fibrosis, such as pulmonary hypertension and liver disease. All aspects need to be reviewed and monitored as this 2-year-old's disease progresses. In addition, the case management worker should follow up with the financial aspect to ensure that there is little strain on obtaining Wi-Fi, electronics to access telehealth, transportation to medical appointments, and medical supplies are available. An evidence-based plan model helps me to develop and make decisions about a proposed plan because it is a structure that allows for thorough and accurate research to be conducted. It is important for researchers to follow a plan model because with its guidance, it will prompt all aspects of research to be considered. The Ottawa model of research uses an assess, monitor, and evaluate system to see the outcomes of processes put in place. This model assesses the barriers and supports that are present as a plan is implemented. The assess aspect of this evidence-based plan model are the suggestions I mentioned earlier, such as more educational material and providing better access to the enzymes needed for the patient's nutritional status. The next step in the plan is to monitor and progress the implemented plan. This includes how the parents are using the new education and the nutritional status of the patient. Lastly, the outcome of the plan are evaluated to determine the effectiveness of the process. You can evaluate the effectiveness by asking questions such as, how is the patient's nutritional status now? Do the parents understand the life-threatening aspects of this disease process and when to seek a doctor? Do the parents have a support group that will help with their transition? Using this model allows for the patient to be the primary focus because the plan is formulated with the specific patient in mind and the effectiveness is reviewed. The benefits of remote collaboration in this scenario are that the patient and the parents can get faster access to healthcare professionals, which is important for an extensive diagnosis like cystic fibrosis. With the video aspect of telehealth, the providers can see in real time what is happening with the patient and can evaluate some aspects of the patient's health. Overall, telehealth brings the care to the patient, and in this case, they're an hour away. This also allows for many different disciplinaries to talk together with the patient or family at once. There are also strategies that could help overcome the challenges in this scenario. For financial issues, there are opportunities to charge Medicare or Medicaid or programs that can help reduce the cost. Internet connection is important to ensure that parents can access a provider easily for any concerns. For the emotional aspect for the parents, there are support groups that can help with the transition. Telehealth that was mentioned previously will drastically improve the patient's care because of their distance from the providers. In summary, educating the parents on what to expect with this diagnosis and when to contact a doctor is important in ensuring safety for the patient. Utilizing telehealth is important in this case because of the distance from medical providers. Using an evidence-based plan model, such as the Ottawa model, will ensure research is conducted efficiently. By overcoming the obstacles and implementing the plan, the patient will have a smooth transition into appropriate care to manage cystic fibrosis.